Yeah, you are able to hear my voice and see my screen?
Yes.
Okay, now I'll start. Sorry for the delay. There was a technical issue with my Wi-Fi. So this took time, yeah? Yeah. Okay. So we were discussing about the TNM system of staging. We saw the Roman numeral staging. Now we'll see the TNM system of staging. So basically, even the TNM system of staging talks about the extent of spread. Okay, so it measures the size of the primary tumor. So in the TNM system, you will understand what is the size of the tumor and how is that denoted with the letter T. Okay, so T will designate the size of the tumor. So in basically what happens is the extent of spread when you want to know the size of the tumor, then it is designated between T0 to T4. So depending upon the type of cancer, T1 will mean that, say for example, in breast cancer, the size is 2 centimeter. T2 will indicate it is between 2 to 4 centimeter. So for every cancer, the designation, the meaning of T1, T2, T3, T4 will vary. But you will understand that with T1, the size is this much, with T2, the size is this much, with T3, it is this, and with T4, the size is this. Okay. So T designates the size of the primary tumor, absence or presence of cancer in the lymph nodes. See, basically, we know the size of the tumor. Now you want to understand whether any lymph nodes are involved or not. So lymph nodes are present in our entire body, right? So that I mean, lymph nodes are a part of the lymphatic system where the lymphatic fluid actually filters itself, right? So these lymph nodes are present all around our body. So if the disease is there, it is small or big, but around the disease, if any of the lymph nodes are involved, then you want to know that also, right? So how is that designated with the letter N? N stands for nodes. So N stands for the number of nodes involved in the cancer. Now, if it is N0, that means no nodes are involved. If it is N1 means 1. If it is N2 means 2 nodes. So like that till N3, N4, how many nodes are involved. And then lastly, you want to know whether there is metastasis or not. That means whether the disease has gone and spread to the other organ or not. Okay. So only then you will understand what type of treatment has to be given to the patient. Right. So that is designated with the letter M. M stands for metastasis. So if it is M0, that means there is no metastasis. But if it is M, then it means that there is metastasis. M0 means no metastasis. M1 means there is metastasis. You don't have in between like M2, M3, M4 like that. So for metastasis, there is or there is no. Okay, you have only two terminologies here, M0 and M1. If it is M0, no metastasis. If it is M1, means there is metastasis. So with this information, the oncologist can decide what type of treatment has to be given. First, they know where exactly the tumor is. Okay. They can locate it with the imaging technique. With the biopsy, it has been confirmed. With TNM system or with Roman numeral system, they can know the extent of spread. And what do you mean by extent of spread? First of all, what is the size of the tumor and how many nodes are involved, plus whether there is metastasis or not. Then on that basis, they will decide the treatment which has to be given to the patient. So this information of staging is very important for deciding the treatment. Also, even the differentiation should be known whether the patient is poorly differentiated or highly differentiated or moderately differentiated, and on that basis also the doctors decide what treatment has to be given, because differentiation helps in understanding whether the tumor is fast multiplying or slow multiplying, whether it is aggressive tumor or slow moving tumor. And on that basis, then the doctors or the oncologist will decide whether aggressive chemo has to be given or a moderate chemo has to be given. So all this information is useful for an oncologist for basically understanding the cancer, the extent of spread, and whether it is fast multiplying or not. Okay, so all this information is for the oncologist. I've explained you grade. In addition to tumor stage, oncologists use grade to describe a tumor. Grade identifies a tumor's cell's degree of differentiation. Some cancers are well differentiated and thus resemble normal cells. If they are well differentiated because they have taken up a new structure, new function, so they will resemble a normal cell, which is fully developed. But some cancer cells which are poorly differentiated, they don't resemble a normal cell because they are in the stage of just developing. Okay, so they are poorly differentiated and they don't resemble the normal cell, and that will come under the microscope. So when you have to actually find out the grading, these cells are monitored under the microscope and then they are graded. So the different symbols used to classify or grade the cells are GX. GX means grade not accessible. That means you cannot assess and find out which grade it is. Okay, so it is at a very early stage. So G1 is well differentiated. So they resemble the normal cells. So they will multiply very slowly. G2 is moderately differentiated. Okay, so the multiplication also will be moderate and they will not resemble the normal cell completely. G3 is poorly differentiated. What do you mean by poorly differentiated? They have not, they don't resemble the normal cell, plus they will be very, very fast multiplying also. G4 is undifferentiated, means you cannot actually identify whether it is G1, G2, G3. So that is undifferentiated. So this is how grading is done and this is how staging is done. So what is the difference between stage and grade? Stage basically is the progress of the tumor. It shows the extent of spread and the progress of the tumor, and grade shows the appearance of tumor under the microscope, which shows how aggressive a tumor is. Okay, so that we have already. Now, what is prognosis and what do you mean by prognosis? Prediction of the future course and outcome of a disease and an indication of the likelihood of recovery from that disease is called as prognosis. See, you have to, the doctors have to predict what will be the future course of the disease, how the disease is going to progress, and after giving the treatment, what will be the outcome. Okay, so that the doctors will generally tell whether if the patient takes the treatment or if the patient does not take the treatment. In both ways, what is going to be the future of the disease and what will be the outcome after taking the treatment. Okay, so that future course and outcome of a disease when the doctors share or give the information, and which will vary indication to indication and disease to disease. So that prediction is called as prognosis. So knowing the future course and also knowing the outcome of the disease, you can understand the prognosis of the disease. And that will depend on which parameters, on the type of the cancer, the stage of the cancer, and the grade of the cancer. Also will depend upon patient's age. Yes, because if it's an elderly patient, then the chances of healing or the recovery are slow. If it is a younger patient, it can be faster. So it depends on patient's age also and the general health. So what do you mean by general health? Whether the patient is lean or thin, whether the patient is healthy, the patient's fitness is good. All that is also all that also helps in deciding. And also the response to treatment. What do you mean by that? How well the patient is responding to the treatment. Some patients may respond very well, some may not. Some may have a very poor immunity, so it's possible that they may not respond well. So all that will also vary patient to patient. So the prognosis will depend upon type, stage, grade of cancer. It will also depend on the patient's age, general health, and also it will depend on the response to treatment, right? Now coming to what are the different treatment options for treating cancer. If it is a solid tumor, first and foremost, till the time it is in the stage 3, surgery is possible. Stage 1, stage 2, stage 3, surgery is possible. That means In stage 4, only in stage 4, in TNM system or even in Roman numerals, if you see, stage 4 is a stage where metastasis takes place. When metastasis takes place, their surgery is generally very, very difficult. Okay. So most in stage 4, in very few indications only you do surgery. So in solid tumors, the prime modality of treatment is surgery. By doing surgery, you can resect the maximum amount of tumor, okay, and can remove all the nearby affected areas and make the patient free of the disease. And later on, if required, patient might get radiations or chemotherapy. Okay, so by doing surgery, you try to remove the maximum possible cancer. Now, by giving radiations, you give radiations are given today in various ways. Yeah, electron beams, X-ray beams, positron emitting radiations, various types of radiations given. So, by giving radiations, you kill the cancer cells, and sometimes the nearby cells are also getting killed, or there is necrosis. So, you have to give certain precautions and take precautions. But today, in radiations also you have a lot of variety. There are radiations which are given pinpoint at the site where the cancer is, so that it does not cause damage to the nearby areas. Yeah, sometimes patients do experience nausea vomiting, which is called as radiation induced nausea vomiting. For that also you have treatment, so patients can take the treatment before starting the radiations and even post radiations. By giving radiations, sometimes patients' skin is affected. There can be some discoloration or burning sensation, or patient can get blisters, dry skin, all sort of things can also happen. So for that also you have some treatments which can be given. But radiation is also a very good option for treating cancer, and it targets the area where exactly cancer is present, and especially if it is a deep-seated cancer where surgery is not possible, and maybe giving chemo is also difficult, so their radiations can reach. So it is also a very good option in various types of cancers, right? And today you have n number of techniques for giving radiations. You have the cyber knife technology, you have the brachycardia, you have internal and external beam radiations, various types of radiations also which have come up. Then, of course, chemotherapy, which we will be studying. Chemotherapy is basically you are giving drugs to treat cancer. So those are called as chemotherapeutic drugs. You'll see this here. Yeah. Chemotherapy is a type of cancer treatment that uses drugs to kill cancer cells. So we will be studying all this. And today you have biomarker testing for cancer treatment. Biomarker testing is you actually check, you go to the level where you can find out which gene is affected, which proteins is affected, and if any other substance, which is called as biomarkers or tumor markers, which are affected. After testing that, then you give the treatment. Okay, so that is a very pinpoint type of a treatment. So you first test the biomarkers and then give the treatment. So generally monoclonal antibodies and things like that are given, or targeted therapies are also given. Chemotherapy I've explained you. Then you have the hormonal therapy. Hormonal therapy is basically you're giving a hormonal drug to the patient. Generally, they are given for breast cancer and prostate cancer, because these type of cancers grow fast or grow well in the presence of hormones, right? So you have to give hormone therapy to stop the growth of breast and prostate cancers. And to stop that, you give different type of hormones, or you give a hormone which can actually stop the production of the hormone which is actually making the free availability of hormones in these type of patients. Okay, so you have hormonal therapy also which is given. Then nowadays you have a technique called hyperthermia. This is, of course, we will not study all this in detail, but I'm just giving you for your information What is hypothermia? Hypothermia is a type of treatment in which body tissue is heated to a temperature like 113 degrees Fahrenheit to help damage and kill the cancer cells with little or no harm to the normal tissue. So basically here what happens is you give or you provide a lot of heat to the area where actually cancer cells are present, and then the cancer cells only get killed or damaged and they don't affect the normal tissue. So those precautions are taken. That is called as hypothermia. Then you have immunotherapy. Just one second. My video is off. Sorry, my video is off. Yeah. Yeah. So then you have immunotherapy is a type of cancer treatment that helps your immune system fight cancer. See, I told you, you have the lymphatic system running in the body. So this lymphatic system is actually mainly responsible for the immunity of the patient. Now, what happens when any normal person gets any type of disease? Okay, any cough, cold, any bacterial infection or viral infection, the body will first itself fight against that particular bacteria or virus. Okay. So what will it do? The body will first identify the cause, that is the antigen, it's the bacteria or the virus. It will first identify it and then it will make some antibodies to kill the antigen, right? So that is the antibody antigen mechanism. So body is fighting against the infection. Similarly, if the body is coming in contact with any carcinogenic agent, the body will first fight fight to protect the body from this carcinogenic agent. It could be smoking, it could be tobacco, it could be alcohol, it could be anything for that matter. So body will first try to fight. So this has the normal process which happens. So the patient on just first exposure to a carcinogenic agent may not get cancer. The body will first try to fight. But if your body is not able to fight, either because your immune system is weak or there is some deficiency or one component of immune system is not working properly, then in that case, what will happen? The patient can get cancer. Okay. So something fails or something goes wrong in the immune system, only then you get cancer, right? So what is a new trend and the new technology today? You give the cancer treatment, everything, it's fine, it's correct, but you give a treatment which will actually build the patient's immune system also, right? So basically you're trying to enhance the patient's immune system by giving immunotherapy. So if you build the patient's immune system, then what will happen? The body's immune system will also work, plus the treatment that you're giving will also work. So there is double benefit. The body is also fighting against that cancer, plus the cancer treatment that you give is also fighting against cancer. Therefore, the improvement and the outcome will be much, much better. So that is the immunotherapy, and that's a very running treatment today, given along with chemotherapy and radiations also. Then you have photodynamic therapy. Here, photo, as the name suggests, you can understand it is with respect to light. Photodynamic therapy uses a drug activated by light to kill the cancer cells and of course all the abnormal cells. So here, like by giving heat, you were giving the hypothermia treatment to kill the damaged and the cancer cells. But here by giving light at the site where the cancer cells are present, you kill the cancer cells and also the abnormal cells. So these are also some of the latest technologies which are being used. Then of course I told you the radiation therapy. Then you have stem cell transplant also. See, patients can be given only stem cell transplantations or it can be combined with chemotherapy. Now what happens is when the patient is suffering from a particular type of cancer, which is in the bone marrow, so either the RBCs or WBCs or anything, something goes wrong or is in haywire condition or is in abnormal levels, then sometimes patients have to be given stem cell transplantations also. So what is this procedure? Stem cell transplants a procedure that restores stem cells that grow into blood cells in people who have had their destroyed by doses of chemotherapy or radiation therapy. See, by giving stem cells, you are giving these stem cells are the stem cells of the blood cells. Okay, so basically, either you give patient their own stem cell which is preserved. Yeah, so that is called as autologous stem cell transplantation, or you give a donor's stem cells, but it has to match. The HLA test is done for that. You match the donor's marrow, and only if it is matched, then it is given externally. So by giving the stem cells of the donor or of the patient, you give the stem cells, they will multiply into blood cells in the person who is getting the treatment. And this stem cell transplantation can be given along with chemotherapy or with radiation, or and even when you have to do stem cell transplantation, you give chemotherapy first to remove the maximum number of cancer cells, and then do stem cell transplantation. So there are various modes of operandies. Now, for stem cell transplantation, the doctor or the hospital will generally admit the patient for minimum 30 days and maximum could be 100 days. So it's a very lengthy procedure. The patients have to be kept in a very isolated condition, and where they are kept, they are completely free of any bacteria, virus. There are multiple layers of air filters in the area where they stay, and no one is allowed to meet them because their immune system is very weak at that time, so they may catch infections very fast. So they are kept in a very protected area. So it's a very lengthy procedure, but that is also a technology which is being used today. Okay. Then of course surgery I have already told you. Then you have targeted therapy. See, basically, targeted therapy is a type of cancer treatment that targets the changes in cancer cells that help them to grow, divide, and spread. See, in the body, there are various changes that take place, like the tyrosine kinase enzymes are present. Uh, so, if these tyrosine kinase enzymes are present in large quantities, then what will happen is the certain types of cancers like lung cancer will multiply very fast. So then what type of treatment are given? You give tyrosine kinase inhibitors. That means they will inhibit the tyrosine kinase growth. So if the tyrosine kinase growth is inhibited, then automatically TKIs will not be present, and then the further cell multiplication cannot take place. So these are pinpoint targeted therapies which are given today, and we also have molecules in that category. So once we take up the molecules, you'll understand that better, right? Now coming to the types of treatment modalities. So different types of treatment that are given to the cancer patient. So what are the terminologies used for these type of treatments? I'll explain you that. So what is primary modality? This is the traditional or the most effective therapy. Is the traditional the most effective therapy? Why? Because it's the treatment which is given for the first time to the patient. So generally for solid tumors, the first time treatment that you give is surgery. So surgery becomes a prime modality. But if it is a hemat indication, like a leukemia or lymphoma, you give chemotherapy. So the chemotherapy that you're giving for the first time becomes a prime modality. So that is primary modality. So what is neoadjuvant therapy? First, for neoadjuvant therapy, you need to understand what is adjuvant therapy. So adjuvant therapy is given primarily after the prime modality. Okay, so the treatment that you give after the prime modality, which generally in solid tumor is surgery. So the treatment that you're giving after surgery becomes, but which type of treatment? The chemotherapy or the radiation therapy, but 99.9% is chemotherapy. So the chemotherapy that you're giving after the surgery or the prime modality, that is called as adjuvant. So the treatment that you give after, just 1 second. आप लोग कब को time है? Yeah, sorry. So the treatment that you give after the primary modality is called as adjuvant treatment. So after surgery, you're giving any chemo, that is called as adjuvant therapy. Okay, so what is the purpose of giving this adjuvant therapy is to treat microscopic residual disease. So after doing the surgery, also some cancer cells will remain in the nearby area or even in the blood media. Okay, so then what is done? You give chemotherapy, which will manage the systemic cancer cells which are present, the remaining cancer cells which are present, and therefore the patients, this therapy is called as adjuvant. So what do we mean new adjuvant? The treatment or the chemotherapy that you give before prime modality. Okay, so the first treatment is surgery. But in case you have to give a treatment, generally which is chemotherapy, before prime modality, that is called as new adjuvant. But why is a treatment given before prime modality? It is the role is to treat potential metastasis or to shrink a tumor so that it is easier to irradiate. Now, see, by doing surgery, you try to resect the maximum amount of cancer which is present, right? So, if you do that, then of course the patient is generally free of the disease and some chemotherapy can be given. But sometimes what happens is the size of the tumor will be very big. So doing a surgery might be very difficult. So by giving some chemotherapy or treatment, you try to shrink the tumor to a size where you can resect or you can do the surgery easily. Okay, so that is called as neoadjuvant treatment. So you give a treatment to shrink the tumor, or sometimes the disease has spread, metastasis is there. So to manage the metastasis, you give a new adjuvant therapy, because if you can manage the metastasis, then you can do the surgery of the from the area where the cancer has started, from the prime modality or from the primary tumor, you can do the surgery. For the metastasis, you're giving neoadjuvant treatment, and from the place where it originated, the primary tumor, from the place where it originated, you can do a surgery. So these are the different treatment modalities which are done and the terms which I use. Prime modality is the first treatment, neoadjuvant is before prime modality, what you give, that is neoadjuvant, and what you give after prime modality treatment, that is called as adjuvant therapy. Now, there are various parameters on which we monitor. This I think we can skip because currently your injectables, we are doing only orals, right? Uh, no, but you're going to get injectables also. Fine, fine. I'll do this also. Yeah. So measures of treatment efficacy. Now the doctor has knows the type of cancer, the extent of spread, and what treatment has to be given. They decide which chemo, which surgery, what everything, right? But how do you measure what is the how is the treatment going on? What is the efficacy of the treatment? So how do you measure that? Now, supposing if a patient has got fever, right? You give paracetamol, you give the treatment, right? Uh, but you can judge whether the patient's fever is coming down or not by measuring with the thermometer. Okay, so if the temperature is lowered, you understand that the fever has gone or the fever has reduced, right? If a patient has got a lot of coughing, cold, and you give some antibacterials or antivirals, after 1 or 2 days, the patient stops coughing, the patient feels better, becomes in control. Understand the treatment has worked. Okay. So you can understand whether treatment is working or not. But in an oncology, how do you understand whether treatment is working or not? So there are some parameters on which you monitor whether the patient's treatment is working or not or is efficacious or not. So which are those parameters? So these terminologies you'll have to understand in first go. Today I will explain you. But again and again you will have to read, and only then you will be able to remember them, right? So don't think that in first attempt you will remember. Today you just understand, but keep practicing, 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 then you will remember, right? First is partial response. So what do you mean by partial response? 50% reduction in the size of tumor and no areas of cancer. So from the name itself, you can understand partial. That means 50%. So 50% reduction in the size of the tumor and no new areas of cancer. That means patient's tumor has reduced by 50%. The size of the patient's tumor has reduced by 50%. And plus, there are no new areas of cancer. So that is partial response. Okay. So that means if the size is reducing, we can say that this drug has worked and there is partial response. Now, what do you mean by complete response? Absence of all signs and symptoms. Okay. The patient will not complain of any signs and symptoms of the disease. So, absence of all detectable cancer after your treatment is completed. So, after the treatment is completed, the cancer cannot be detected, cannot be seen. Complete response does not necessarily mean that you are cured, but it is the best result that can be reported. It means the cancerous tumor is now gone and there is no evidence of disease. Yeah. So basically, the patient is not fully cured, but you are not seeing signs and symptoms of the disease. So the cancerous tumor which is there, that has also gone. The lump which was there, that has also gone. The nodes which are involved are also gone. But there could be some cells in the blood which could be present. Some cancer cells could be present here and there. Therefore, the patient is not fully cured, but signs and symptoms have gone and the disease is not visible. Okay, so that is complete response. So in that case, also the patient is monitored and the type of treatment will differ. Now, what do you mean by response rate? Yeah, so here we saw about partial response, complete response, right? So now this we are talking about response rate. Whenever in oncology you have rate, rate means percentage of patients. Okay, what do you mean by that? Percentage of patient means supposing there are 100 patients and we say the 20% is response rate. So that means out of the 100, 20 patients showed some results. So that is 20% response rate. So rate means always percentage. That means out of 100, how many were affected? Supposing if the number is 200, if 100 is affected, that means 50% is the response rate. So whenever it is rate, it means percentage of patients. So response rate means percentage of patients whose disease regressed after treatment. That means the treatment was given, there was regression, there was improvement. That means the size of the tumor was decreasing. The disease was showing some improvement, there was regression. So that is response rate. So that is response. But response rate means percentage of patients. So in that group, and whenever you have response rate, it means percentage of patients. Why you have percentage of patients? Because whenever we talk about response rate and such things or efficacy, we are always discussing on the trials, right? Different trials keep taking for the molecules. So when we talk about response rate, we are talking about a study in which there could be 300 patients, 400 patients, 500 patients who were given the treatment. So how many patients in that study showed some regression or improvement? So that if you have to calculate that you do in terms of percentage of patients. So therefore the word rate is added. So percentage of patients who showed disease regression is called as response rate. Complete response rate means percentage of patients who were fully treated showed no signs and symptoms of the disease present. Like we saw complete response, the patient was fully treated, no sign and symptom of the disease, no evidence of the disease, but at the site, but there could be some cells present here and there in the body. But this is called as complete response. But when it is percentage of patients who showed complete response, that is called as complete response rate. So what is partial response rate? Partial response is 50% reduction in the size of the primary tumor. So what is partial response rate? Percentage of patients who were incompletely treated or who showed 50% reduction in the size of the primary tumor, that is called as partial response rate. Okay. So this you might find it slightly difficult in the first time, but after practicing you will understand it in a better way, right? Then you have survival rate. We saw the disease regression. Now we always, when it comes to onco or cancer patients, we try to see whether the disease, after the treatment, how long the patient is going to survive. Okay, so how that is monitored on the basis of survival rate. Survival rate can be 1 year, 5 year, 10 year, etc. But how do you calculate that? For example, when you talk about 5 year survival rate, it means the percentage of patients whose disease, patients who are still alive 5 years after treatment. Okay, so the patient starts the treatment today, but if the patient is alive after 5 years, yeah, so then we will say that is the 5 year survival if the patient is has survived. But supposing if the patient starts the treatment today and lives for starts treatment today and lives for 2 years, that means his survival was 2 years. If the patient stays for 10 years plus, that means the survival is 10 years plus from the day the treatment starts. Okay. Now, what is survival rate? It is the percentage of patients who are still alive 5 years after the treatment. Okay, so if it is 10 years survival, it will be percentage of patients who are still alive 10 years after the treatment. So that is survival rate. It is important for us to know the survival rate because generally the patients or even the patient's family members would like to know how long the patient is going to live. So for that purpose, survival rate is also required. You have disease-free survival. What do you mean by disease-free survival? The measure of time after treatment during which no sign of disease is found, a sign of cancer is found. So when you start the treatment and after some time or after a time span, there is no sign of cancer. So from the time you start the treatment till the time the patient becomes free of cancer or no sign and symptom of the disease, and even the disease is not present. So that time gap is called as disease-free survival. Okay. Later on, it might happen the patient's disease comes back, but till the time he was free, that is disease-free survival. Why this is important? Because in studies you will see there are certain molecules whose disease-free survival is more. That means the time from when you start the treatment and the time the patient remains free of the disease, if that is more for a molecule or a combination or a protocol, that means the disease or that means the product or the molecule or the combination is good. Therefore, you have to understand what is disease-free survival. Now, what is progression free? See, here you can make out from the name itself, disease free. The patient is free of the disease. But from when? From the time the treatment has started. So that is disease free survival. Progression free survival. From the name you can understand progression free. The disease is not progressing, although the patient's disease progression has stopped. The time between start of treatment till the time cancer does not progress or worsen. That means you start the treatment and the cancer does not come back or does not progress or does not increase. That time period is called as progression-free survival. Okay. From the time you start the treatment until the time the patient's disease starts progressing or starts increasing or starts becoming worse. So that time period is called as progression-free survival. Okay. Now, yeah, progression-free survival rate, the percentage of patients whose disease is still present but has not grown. Progression-free is the disease is there but it is not growing further. That is progression-free, right? But progression-free survival means the percentage of patients whose disease is still present but has not grown. Now, what is stable disease? Stable disease, the cancer has stayed the same size. It has not got better or worse. So that is stable disease. That means originally when you started the treatment, the size of the tumor was say 2 centimeters. The size of the tumor remains 2 centimeters. It is not increasing, neither it is improving, or nor it is getting worsened. It remains the same the way it is. So that is called as stable disease. In some cases, patient's stable disease has to be good. Why? Because in some cancers, if the patient can be maintained in the place or the stage where he is, that itself is beneficial. So that is called a stable disease. So therefore, knowing stable disease is also very, very important. There are two more terminologies. One is time to progression. What do you mean by time to progression? How long it has taken for the disease to progress following a particular treatment. Okay, you give a treatment and then the disease starts to progress or worsen. Okay, so the time from where you give treatment and then the disease starts to worsen or starts the relapse or recurrence, that time period is called as time to progression. Time required for the disease to progress. What is event-free survival? The time between treatment and having a specific event such as a symptom, type of pain or a fracture, that is called as event-free survival. Time between treatment and a specific event of a symptom. Okay, so by event we mean a symptom that comes back, a pain or a fracture, or say for example the blood counts go very high. So any one symptom occurs, so then that time period is called as event-free survival. From the time you give treatment till the time the symptom comes back, the event comes back like pain, fracture, anything for that matter, that time period is called as event-free survival. So all the parameters that we have seen are helpful for us in understanding whether the treatment is working or not, or the regimen that we are going to that we are giving to the patient is working or not, whether there is improvement in the patient or not. So all these parameters will help you in understanding that. Any questions? Yes, if you all have any questions, you all can please ask.
No, we don't have. Thank you.
So what does that mean? Whether you have understood everything or you have not understood or what? How do I take it?
We understood. Yeah.
You understanding? See,
We
certain
understood. Yeah, we
terminologies.
understand.
Okay, certain terminologies you will find are new and you might find them a bit difficult, but as in how you start working, you will get familiar with them and then you will understand it better. And the more and more you read, the more and more articles you read and all that, you will understand. So some terminologies, like what I took, those efficacy parameters, you will take some time to understand, learn. But I thought I'll just explain you, right? So seriously, no questions? Anything, any doubt, anything? If you all have any doubt, you all can ask me now. But if you still are not able to, but in future, anytime, today, tomorrow, or even maybe after that, if you have any doubts, please feel free to contact me. You can take my numbers from Osama, and you can anytime contact me, right? If you all have any doubts. So let me know. So I can anytime clarify. If it is not possible today, maybe after reading you can understand it. You may have doubts later on, like today in the late night, maybe tomorrow, maybe even after that. Anytime you all can contact me and I can clarify your doubts, right? So please feel free to contact. There should be no problem in that. Yeah. Acha, see now I have the second set of basics of oncology. But I like to have a break, so you all can also have your lunch. So I can also have my lunch. So we can join after 30 minutes. We can rejoin after 30 minutes. Hello? Hello?
So 30 minutes is not enough.
30, not enough.
Let us go. Yeah.
How much? How much?
Let us do 1 hour. After 1 hour.
1
After
hour?
1 hour.
Okay. But you can
Yeah.
extend late in the evening. Can we continue the training for late in the evening?
What?
See, if I give
Evening
you
means?
1 hour, if I give you 1 hour break, then I will have to continue the training till late night. Will that be okay? Because we have started also late. We can extend uh, uh, till 7 o'clock, 8 o'clock at night.
Night.
Yeah.
Night. We have to discuss first.
Okay. So let me know that. But we are meeting after 1 hour, right? According to Indian time, it is 1:45. So 2:45, we are joining back. Yeah. Hello. So we are meeting after 1 hour. You rejoin after 1 hour, right? Is that,
Yeah.
is that okay? After 1 hour, right?
Yeah. It is okay.
Okay,
agree.
okay. So don't delay. Be there after 1 hour. Yeah.
Okay.
Okay. So you are can leave. Yeah. Break for lunch. Yeah. Okay.
Thank you.
Yeah.
Saga